tonight.
People need to be tested because it does save lives.
An ABC 27 special presentation.
It sounds odd to say I'm a cancer survivor.
In recognition of National Colorectal Cancer Awareness Month, the Penn State Hershey Cancer Institute presents Colorectal Cancer, a Matter of Facts. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening. I'm Chuck Rose. Thanks for joining us. You know, over 140,000 people are diagnosed with colorectal cancer every year, and 60,000 people die from it. More than 90% of these patients are over the age of 40. However, there's good news. That is that 80 to 90% of colorectal cancer patients are restored to normal health if their cancer is detected and treated in the earliest stages. Tonight, specialists from Penn State Hershey Cancer Institute are in the ABC 27 call center till 8 o'clock. They're here to answer your questions about colorectal cancer. Deborah Pinkerton will be with us throughout the show to share some of those questions. Well, joining us first off the top here is Dr. Walter Colton, the Chief of Colon and Rectal Surgery. Welcome, Doctor.
Pleasure to be here.
And it's hard to believe it's been a year already, but it was just a year ago that last June the new Cancer Institute opened its door to patients. Tell me about how that's benefited the hospital staff and the patients.
Well, colorectal cancer specifically is a disease that frequently requires the expertise of many different types of caregivers, surgeons, oncologists, radiation therapists, radiologists. And the Cancer Center brings all of these individuals together under one roof. It provides for a more efficient care process as well as something that's much more pleasant for the patient themselves.
You know, we see a lot about colorectal cancer in the news and so on. It seems as though it's a type of cancer that can almost be prevented. Is that the case?
Yeah, that's absolutely the case. And in fact, colorectal cancer cure rates are improving all the time. The mainstay of prevention really is the colonoscopy. Most patients who are of conventional risk, meaning to say they don't have a family history of colorectal cancer, should have a colonoscopy at the age of 50. Colonoscopies are very effective at preventing cancer by removing the tumorous growths that are the prelude to the actual cancer, namely polyps. And so colonoscopies can remove those polyps and thereby avoid developing colorectal cancer. In addition, there's obviously lifestyle things that can prevent or inhibit the development of colorectal cancer. Smoking and high-fat diets have been associated with colorectal cancer. Improving those sorts of issues, including stopping smoking, for example, will also decrease the risk of colorectal cancer.
That's interesting. Now, because some people, if you mention this procedure to them, they're afraid. What can you say out there to the viewers tonight that makes it sound safe and it's not embarrassing?
Well, basically, it is safe. That's the bottom line. And I think most patients who go through the process afterwards are the best spokespeople for the colonoscopy procedure because they usually find out after the fact that it really wasn't as bad as they thought. Usually takes 10, 20 minutes. Patients are usually leaving the procedural area in about an hour after the procedure, and they rarely remember it. They're sedated very effectively. So colonoscopies really are very safe, very well tolerated, and most patients after the fact are happy they had it, especially it provides them a lot of relief.
You did, and we did mention that, you know, a lot of people put off getting their colonoscopy. Well, as a Dauphin County man, he's an example of someone who avoided this procedure, but who's very thankful now that he finally had it done.
Ladies, good day. Kristen, Jen, how are you?
Good, how are you?
Good. Have a busy day today?
Brian O'Day loves his job. And who wouldn't love working at one of the sweetest places on earth, the Hotel Hershey? As general manager, he's in charge of everything. He spends 12 hours a day making sure this luxury hotel is appealing to anyone who walks through the door.
We want them to feel that this is an extension of their home, a place that's very easy and accessible to get to use and relax, enjoy themselves.
Brian puts so much emphasis into his work and thinking of others, he postponed a very important date, his colonoscopy. Not once, but twice.
There was actually no fear. I just did a very poor job of not prioritizing it into my schedule. And a little bit of that, I feel good, everything's fine, you know, what could be wrong approach.
Dr. Ann Young says the recommended age for a colonoscopy is 50, but she says many people put it off.
They do it for a variety of reasons. Because people are not having any symptoms and no family history, they can't imagine it can be happening to them when they feel fine. Or they put it off because they don't want to have the prep. And often it is because they're very busy and it does involve taking a day off work.
3 years ago, Brian found the time to have the colonoscopy.
Went in just very confident, something to check off my list. After I come out in the recovery room for that, Dr. Young has a very concerned look on her face and wants to sit down and talk.
We did find a small cancer. Looking at it, it was hard to tell whether it was a flat polyp or a cancer. There were some worrisome features about it, and the biopsies did come back that it was a cancer.
It didn't really hit me. It was like, well, okay, that's fine. You know, just take care of that, and on we go. And she had to convince me it was a little more serious than that.
Brian had to break the news to his wife and 2 children who were in college at the time.
It wasn't something that I wanted to call the kids about and say, hey, hop on the phone. So I drove down to their college. Thankfully, they were both in school together down to Virginia, and you know, sat and told them, and you know, very shocked looks on their face and great concern. The next week, I went to see Dr. Colton and walked me through what the diagnosis is and what had to happen, and a certain urgency to it.
He needed to have surgery. That surgical procedure for him required the removal of a piece of his colon, and then we put that piece of colon back together so that then he returned to having normal function of his gastrointestinal tract.
A month after the diagnosis, Brian had the surgery. Dr. Walter Colton says since the tumor was the size of a quarter, the procedure could be done laparoscopically. The incisions we made were small keyhole type incisions, and we used instruments that are very small and like chopsticks with little scissors and little grasping instruments on the end that allow us to do the surgery in the abdominal cavity without making a large incision. Dr. Colton says the surgery took about 2 hours. Soon after, Brian found out the great news. Fortunately, it had not spread to the deeper portions of his bowel, so he had all of his lymph nodes were negative. So effectively, he was cured with the surgery. A cancer survivor. Do you feel like it saved your life?
Oh, absolutely, absolutely, saved my life and changed my life in how I view things and how I look at things, and certainly a very fortunate person.
Brian said he's telling as many people as possible about the importance of a colonoscopy, because he says if he would have postponed it another year or so, who knows what the situation might have been. Back to you, Chuck.
He acted quickly and efficiently, too. Doctor, what are some of the symptoms and signs of this kind of cancer? Is there something that you should be watching for?
Well, it's a tumor, it's a growth that happens in your colon, and so it relates, the symptoms relate to defecation, bowel habits, if there's blood in the stool, or if there's difficulty having an evacuation, if there's unusual diarrhea or constipation or abdominal pain. Those are all the features that would suggest there might be a problem that could lead to a diagnosis of colorectal cancer.
Okay, we're going to break right now and go back and let's check with Deborah Pinkerton in the ABC 27 call center, find out what kind of questions we're getting from the viewers. Deborah?
Hi, Chuck. We're getting all kinds of questions in here, a lot about colonoscopies, about the whole fear factor, about insurance. When should you get it done? Keep trying. If the lines are busy, keep trying to get through. If not, while you're waiting, you can go to PennStateHershey.org/colon-and-rectal to read the patient guide. Now, joining me here in the call center to help answer these questions that are coming in is Marjorie Lebo, a certified registered nurse practitioner for colorectal surgery. Thanks for being here.
It's a pleasure to be here. Thank you.
And this is our first viewer question. Because I have a family history of colon cancer, my doctor suggests I get a colonoscopy every 5 years. Should I have the test done more often? And at what age should I stop getting the test? I've heard it's a slow-growing cancer.
With a family history of colon cancer, screening may need to be started before the recommended age of 50, and it may need to be done more often. For example, if you have a parent that was diagnosed with colon cancer at age 50, you should have a colonoscopy at age 40 or 10 years prior to their time of diagnosis. As far as the length of screening goes, we've had healthy individuals in their 70s and 80s continue with that.
Okay, great. Thanks so much. And we will have more viewer questions coming up later in the show. Back to you, Chuck.
Thank you, Deborah. Doctor, are certain people more at risk for this type of cancer than others?
Yes, absolutely. And as you just heard, if you have a personal history of colorectal cancers in your family, such as a first-degree relative, a mother, father, sister, brother, aunt, that puts you at significantly increased risk, and your screening for colorectal cancer should occur at an earlier age. There are other diseases, too, that can predispose to colorectal cancer, such as ulcerative colitis and Crohn's disease. And then there are other tumors that you can have that are associated with colorectal cancer. So ovarian cancer, breast cancer, kidney cancers, such cancers can also put you at increased risk. And so if you've had one of those, you should probably get a colonoscopy sooner than the usual patient.
And what kind of treatment options are available for this?
Well, the mainstay of treatment, and treatment these days is very good, the mainstay of treatment is really surgery, even if it is a polyp removal during the colonoscopy. Obviously, tumors can be larger than that, and then more significant surgery should be performed. As you heard in the previous Mr. O'Day's discussion about how he went through this, he had a laparoscopic procedure. So you can do surgery laparoscopically through these keyhole incisions that can get people out of the hospital very quickly and back to full speed in a couple of weeks. Obviously, if the tumor is more advanced, chemotherapy, radiation might be necessary, but again, colorectal surgery should be performed in a fashion that provides for the highest cure and the best outcome. The surgery is the mainstay of care.
Well, they made a lot of progress as the years go by.
Absolutely.
Well,